What is diabetes? This is very common question which is being asked everywhere, that what is diabetes and how to early diagnose diabetes, how to diagnose diabetes at the very earliest stage, and is diabetes reversible or not. Diabetes is basically a metabolic disorder which is basically due to defects in the either in the insulin secretion or in the insulin action. If there is defects in insulin action, it just means that there is some kind of insulin resistance is there. If there is defect in insulin secretion is there, then it's going to be type 1 diabetes mellitus. If there is defect in insulin action, then it's going to be type 2 diabetes mellitus. But over a period of time, even in type 2 diabetes patients, they will also develop defects in insulin secretion. So in type 2 diabetes, there will be a time will come when they will have both the pathophysiology of diabetes. So what are the risk factors of diabetes? And this is very important to know that uh, if you're if you're pre-diabetic, if there is family history of diabetes, if your age is more than 45 years, and if you're leading a very sedentary kind of lifestyle, you have got hypertension, your cholesterol, SDL cholesterol. SDL is a very good cholesterol. And if it's less than 35 or your triglycerides levels are high, it's around 250 milligram per deciliter, or if your family history of diabetes is there and there is some kind of cardiovascular disease there, if you're taking statins also, it has been seen that those patients who are on long-term statins, we see there is a rise in HbA1c. It's very little, but yes, it's there. And if you're in a pre-diabetic range, pre-diabetes means your fasting is within it's not more than 126, but it's also between 100 to 126 range. Your HbA1c is between 5.7 to 6.4, then it's considered as pre-diabetes. And these are some of the way risk factors for diabetes. And one of the most important risk factors is obesity. So you need to check your body mass index. If it's high, it's more than 23 kilogram per meter square, then you need to be really careful. So what are the consequences of uncontrolled diabetes? Why we need to manage? Because if you have got diabetes, then you are going to develop few complications. We categorize it in two parts. One is called as microvascular complications, and another set is called as macrovascular complications. In microvascular complications, what we see is neuropathy. Neuropathy, the common symptoms are you'll have tingling, numbness, you'll have burning sensation. These are the common symptoms which patients come up with, that in their feet they are unable to feel anything, there is burning sensation, there is something crawling under the skin. So these are the signs and symptoms of neuropathy. Next is retinopathy, where the patient will complain of there is uh, if the patient is wearing specs, then they will complain that the power of the specs, they need to change it very frequently. That's the common complaint which we see with retinopathy. There is blurring of vision also we'll see. And next is nephropathy. Nephropathy, this is the most common complications, and the patients are more worried about nephropathy because they commonly ask कि हमारी किडनी तो नहीं खराब हो जाएगी डायबिटीज की वजह से. And the earliest marker of diabetic nephropathy is to have microalbuminuria. You just need to measure urine microalbumin, and that will give you an idea whether nephropathy is there or not. Then the macrovascular complications, you will develop peripheral vascular disease. That will lead to diabetic foot. You may have stroke, heart attacks because of coronary heart disease, and there is increased risk of transient ischemic attacks, stroke, which is also called cerebrovascular diseases, are much more common in diabetes, and especially during these seasons. In winters, we see more and more cases of heart attack and strokes because this BP usually increases in winter times. So these are some of the diagnostic criteria of diabetes. So if you are having those symptoms of diabetes like polyphagia, if you're complaining of more of thirst, increased urination, and there is some symptoms of urination, you're feeling there is a increase in appetite is there, or if you have suddenly started losing weight, then you should definitely get your blood sugar tested. The better test is HbA1c, that will give you a detail of a past 3 months glucose control. If it's more than 6.5%, then it's considered as diabetes. If you're measuring fasting plasma glucose, then it should be more than 126. Postprandial is considered at more than 200 is considered as diabetes. So, what are the signs and symptoms of diabetes? The classical signs and symptoms of diabetes are excessive urination, excessive thirst, and excessive hunger. These are called as 3 Ps: polyuria, polydipsia, and polyphagia. Other common symptoms are unexplained weight loss, fatigue and restlessness, body pain, tingling and numbness, blurred vision, or unhealed wound. So, these are some of the common symptoms of diabetes.